Hello, my name is Simeon Neil Asher and welcome to Trigger Point of the Week. This week we're going to be exploring gastrocnemius muscle. Now the gastrocnemius is what is the large calf, superficial calf muscle. So I tell you what we're going to do. Let's do a 3D search today for fun, and let's have a little look at the back of the leg. So we can see on the 3D search some of the options here. Soleus, gastrocnemius. Gastrocnemius, as we said, large superficial muscle, takes its origin from the medially from just above the medial femoral condyle and laterally from the back of the femoral condyle itself. The nerve is the medial portion of the tibial nerve, and in terms of activity, obviously we use it for locomotion, mainly for walking, for moving, and it inserts into the common tendon down into the calcaneus there. Hugely important in terms of trigger points. If we look at some of the trigger point maps together, you can see that the medial head, we kind of divide it into 4 trigger points roughly. The medial head tends to, in the belly, tends to radiate pain under the sole of the foot. So really important muscle if there's any pain, people coming in with sort of medial longitudinal arch foot pain, as well as pain strongly in the sort of medial portion locally to the trigger point. Again, one of those interesting trigger points that's distal from the actual problem itself. The lateral head or lateral belly radiates sort of locally, more sort of strongly at the back of the knee. So you'll see it can be sort of a little bit differentially diagnosed with popliteus, and it can sort of present as sort of posterior knee pain. Proximal head tends to be medially, tends to sort of go really across the muscle itself, and the lateral head a little bit more around the fibula. So in terms of gastrocnemius, of course, one of the other things we see is cramp. We see that in the gastrocnemius and the soleus muscle. Cramps can be caused by dehydration, electrolyte imbalance, stress, Parkinson's disease, diabetes. So cramps can cause trigger points over time in the muscles. When the muscles go into cramp, it's one of the sort of predisposing factors. And of course, if you have got trigger points in the calf, it can predispose to problems with the Achilles tendon, so Achilles tendinopathy. Something, of course, we see in athletes. We know that Achilles tendinopathy or synopathy is also characterized by sort of degenerative fatty changes in the tendon, but the presence of trigger points has been shown to sort of increase the nociceptive drive to the spinal cord, and also to be one of the predisposing factors or maintaining factors that can lead to Achilles tendinopathy. So Achilles tendinopathy, trigger points in the gastrocnemius muscle, and as I said, it's the more superficial to the soleus that lies beneath it. So this has been the gastrocnemius. Hope you've enjoyed it, and we look forward to seeing you next week for the next trigger point of the week. Thank you very much for watching.